This is real COVID deja vu, guys. Sorry, don't mean to laugh. Well, thank you all for responding to our media request and being here today to cover some information on measles. We wanted to make the measles cases are actually in Gaines County. However, individuals travel to the Lubbock area for treatment. And this is the first time in 21 years that we've actually seen a measles case in this area of the country. And I just really want to get information, accurate information out to the public about measles, kind of what things people should look for, what the risk factors are, really trying to, I don't want to create public panic, but it's also something that we haven't seen in so long. And a lot of, even physicians in our community haven't seen a measles case. So it's really just about public information and making sure that, we get clear information out to everybody. What we know right now is we know that we've had one individual test positive for measles. That individual had medical care here in Lubbock. However, we have multiple people that are pending test results. So we really do expect to see a much higher case count once all of the testing is completed. But with that first confirmed positive, we really want to make sure that our hospital systems, physicians' offices, public, all know, what is going on with this one case. This is the second group of kind of measles cases that we've seen recently in the state of Texas. Houston or Harris County reported 2 cases last week. And then it's very interesting that we're now seeing cases here in the South Plains. We don't have a reason to believe that those cases are linked, but we are seeing kind of increases in measles in Texas, and that's following national trends where we've seen outbreaks and pockets of measles over the last couple of years. And I have Dr. Cook here, who everybody knows from our old COVID days. I'm going to let him talk a little bit about the measles disease, and then we can have questions from anybody in the audience.
So I wanted to give you an update, just kind of let everybody know what measles is and what it looks like. And Asia, if you'll pull up that slide, there's 2 slides of what the measles rash look like. Let me just tell you, if you're fully vaccinated, and that's really at least 2 doses of vaccines, either at 12 months and then again at 5 to 6 years of age. And then many adults have also received an additional MMR, that's measles, mumps, and rubella. It's 3 vaccines in 1. But if you're fully vaccinated, the likelihood of you having a problem with measles is very, very low. But the thing that makes us most nervous is the infectious nature of this virus. It is the most infectious virus that we know about. So in medicine, we use what's called an R0. An R0 value talks about infectiousness. And that's me so somebody like, if I get measles, how many people can I infect? If we look at flu, it's about 1.3 people that's in close proximity that I can infect. Norovirus, everybody's heard of norovirus, and cruise ships, it'll shut down because it runs through a cruise ship. That's about 2.0. So one person gets it, for every one person that gets it, 2 other people can be infected. COVID was 2.4, so higher. Measles is the highest, anywhere from 12 to 18. So you can imagine how fast measles can spread amongst those individuals who are not vaccinated. So the key is here, you got to be vaccinated. Highly, highly contagious. There's 4 stages of the disease that an individual will go through when they get infected. So the incubation period is anywhere from 7 to 14 days. You get exposed, you get infected, you don't know it for 7 to 14 days. Of the first, or somewhere in there, you've got about 4 days that you're infecting other people that I don't even know about, that I'm spreading the disease. So that we call that the incubation period. That's about 7 to 14 days. Then what we call the prodromal period is another 2 to 4 days. And then our fevers really spike high, anywhere from 103 to 104. Some individuals, young individuals, will have febrile seizures, not epileptic seizures. They look like that, but the fever rises so fast it'll cause an individual to have seizures. So then the 3 C's start. That's cough. You get a cough, you get the fever, you get the cough, you get the coryza, which is runny nose, and then you get conjunctivitis, the watery, runny eyes. So the 3 C's, cough, coryza, and conjunctivitis. And then somewhere along in there, you get the pre-rash or Koplik spots that are in the mouth. And that's, we may have a picture of that. They're little white spots with a red halo around it. We can see those sometimes in the mouth before the rash outbreaks. And the rash, when it comes on, and it's like you see in the other picture, Asia, if you'll put that other one back up. That rash starts at the top of the head and works its way down over the next few days. And you are pretty sick. You've got fever, you've got cough, you've got coryza, you've got conjunctivitis, and you're just absolutely miserable. You may have diarrhea with this as well. And so some of these individuals get pretty sick. They can develop a pneumonia because it's not just external, it's multiplying in your body, and they can get pneumonia. So in that rash phase will last 3 to 5 days, and then the convalescent stage, the healing stage, you can have a cough for up to 2 weeks or 10 days after that. So when are you infectious? You're infectious 4 days before the rash starts, and you don't even know that, up to 4 days after the rash starts for 10 days there. And so you feel pretty poorly. 1 in 5 individuals who catch measles will be hospitalized. So 1 in 5 will be hospitalized, most likely those under the age of 12 months or 1 year of age. The immunocompromised and pregnant individuals may be hospitalized. It can cause premature labor. It can cause spontaneous miscarriages just because of how poorly you feel, and those things happen. The other thing that can happen is cause encephalitis. Encephalitis is an infection. The virus infects the brain tissue itself. That can be pretty severe. You can get over that, but somewhere down the road, there's a rare disease, another type of encephalitis that can happen up to 10 years later. And if you get that form, it can be fatal. So the most likely people to get if you're not vaccinated, the most sick people are going to be children under the age of 12 months, and then the immunocompromised individuals. And so that's all I have about the disease itself. You're really sick. Adults get really sick too. So what I want you to hear is get vaccinated. And you have 3 vaccinations or 2 vaccinations, 1 at 12 months and then 1 at 5 to 6 years. And then a lot of adults also have the opportunity. If you're in healthcare, you've probably been vaccinated again as an adult. And there's the rash.
So with that, we're happy to take any questions.
What precautions should community members take as you notice this case? What can they do to protect themselves and their children, etc.?
Really, the one is if they're vaccinated, there's really very low risk to those individuals. Individuals that are not vaccinated, really, if they think they were a contact or know somebody with measles, then they really should isolate for that 7 to 14 days.
Well, isolation for up to 21 days, because we have to wait for it to multiply, and you have to wait for it to show up, and then it's really, the CDC is a 21-day isolation period. And so if you think you've been exposed and you haven't, like one of your siblings actually was diagnosed with it, we can still give anybody over the age of 12 months in immunization. We can give you an MMR within 72 hours after diagnosis, so and try to prevent it. In some cases, down to 6 months, but you have to weigh in some other factors there. Yes, ma'am.
Are
Krista Martinez Garcia,
Mhm.
Latino Lubbock Magazine, and I know that you said that you guys had to go to the non-digital records from 21 years ago
Mhm.
just to find when the last case actually occurred. But my question to you is, from that, how many cases happened then? Because we know that it is very infectious. Did you happen to look at that information? And what was the way that it was handled other than vaccines? Were there any other precautions that were taken?
Yeah, that's a good question. We just have record that there was a case. Nobody here at the health department actually worked that case. So I don't have the history if there was other people exposed or any prevention that was done.
If I may ask one
Yes.
more question. You mentioned, what was the county that the original case?
So these cases actually come from Gaines County,
Which is,
about 100 miles from here. But as we know, Lubbock's a hub for medical care. So people will come to our doctor's offices. So it's really important that, our physicians and the urgent cares know that there's been a case so that they can be on the lookout, or if they see a rash, they can consider that as a possible diagnosis.
I'm sorry.
Oh, I was just going to say that, and part of this is getting that information out kind of for everybody within even the 100-mile radius to really understand that we've had some cases up here in this community.
If you have a rash or if you think you've been exposed, please call your physician's or your provider's office. Call them, let them know. What they would say is probably stay in your car, we'll come out and test you. There's a swab we can do, the nasopharynx. But don't come into the clinic. It's so infectious. We don't know who's been vaccinated, who's not. There may be somebody that's under the age of 12 months has not been vaccinated in that clinic lobby. So please let them know you're coming, and they will most likely come out to the vehicle and swab you or something like that. So don't go into the clinic, and that you can undress your child or something so we could take a look and see if that's what we really think it is. And by any means, we can also swab and send that off to have it tested.
Do you find that less children are getting vaccinated these days? Is that something that you can speak to?
I think in general, I think there's been a lot of untoward fear toward vaccines. There are many, many studies that say vaccines are safe. They save lives. And the reason we haven't seen measles in 21 years is because most people get their MMR, measles, mumps, and rubella vaccine. But there are individuals who choose not to do that. But with measles, like I said, it's so infectious. It has such that high R0 value. It's the most infectious virus we have right now. And so I think there is vaccine fear more, social media spreads those sorts of things. And the studies show that it's not related to autism. Many, many, many studies of hundreds of thousands of children have shown that it's not related to the MMR vaccine or other vaccines. So I think it's prevalent, more prevalent than it was. It may be that people can talk about it more through social media, so people hear it. It's broadcast louder than somebody standing on the street corner saying something. And so,
unlike COVID, I mean, I know that we did a lot of hand washing, masking, social distancing. I know that we have shared the information on how to prevent, and of course vaccinations are key, but what other precautions should we be taking as like a family or a school?
well, same. Most schools require vaccinations to attend school. And so that's the number one. Get your individual, your person, your child vaccinated. And then the other precautions about exposure are the same. If you see somebody coughing, or if you see somebody that's runny eyes and runny nose, whether it's the common cold or an adenovirus, or whether it's measles, so when I'm in clinic and I see sick patients, I do a lot of breath holding and I do a lot of washing of hands. I when I examine somebody, I stand beside them and let them cough that way and hold my breath and then stand back from them. And so it is spread by measles is spread by respiratory droplet. So coughing and sneezing and runny nose, all that, wash your hands and stay away from somebody if you can. Now, if somebody is truly exposed, or somebody, you're going to have to help them do something, that's when the N95 masks are going to be better than just a surgical mask in that case. Great question, Christy.
And I just have one final question for me. I know the others have one too, but the pending cases how long will we know before we have a final result as far as they have measles as well? When will we know the results of that?
There's a couple of days in order for laboratory tests to be processed. So that's what we're waiting on. This is the first test that came back. These investigations are actually under a different health department jurisdiction. So we don't have direct access to the case counts, but they will share them with us over time. And we do expect them to identify more cases in their community as this progresses.
Others?
As we know, since COVID, our social interactions have pretty much returned to normal. Our daycares are full, schools are full, things of that nature. But we know in those settings, any virus, any sickness spreads like wildfire.
Yes.
What precautions should those facilities be taking?
Well, most of those facilities will say if your child has fever, if they're, any signs of illness, they're going to make you pick up your child and take them home. Don't send your kid to daycare or school if they have a fever. And if they're really, get them in to see their primary care provider. And so, yeah, but measles will spread quickly. To allay some of the fear, though, is that if you're fully vaccinated, you don't have much of a worry.
Since we know that these cases, or this case, has or originated in Gaines County, can you talk specifically to those individuals in Gaines County about what they need to be doing right now?
Well, so I don't know a lot about those cases other than the one that sought care here. But so if somebody gets this sick, we can, and they're not vaccinated, if it's within 72 hours, we can give them vaccine, and it'll certainly help abate some of the symptoms and some of the more poor outcomes. If they're under the age of 6 months old, we can give them immune globulin. It's a weight-based dose of immune globulin, and that's to help. That's the immune response. We're just giving it externally to help their own immune system fight this off. If they're between 6 months and 12 months, it's sort of a toss-up whether or not we give them immune globulin or an early dose of the MMR. We usually don't give MMR till 12 months old, but in this case, because we worry about them, we would give them an early dose. They would still need their normal 2 doses after that, one at 12 months, one at 5 to 6 years of age. So they would actually get 3. And then, so it's within that 72 hours that we really try to do that.
Yes.
Based on our experience with COVID, are we better prepared now? Do we have the vaccines now to treat, or, so that families that have not gotten vaccinations, do we have all that in place? Would that be just at the health department, or where can families go if they need to get the vaccines and haven't had a chance to do that?
Well, the MMR vaccine is something that we've had for years. And it's something that's in stock at most pharmacies. We have it here at the health department. Our health department vaccine is really for children that are Medicaid, CHIP, uninsured. The state is also going to be providing us with some additional doses of adult vaccine for uninsured adults. I've spoken with, one of the pharmacies at our one of our chain pharmacies here, and they are making sure that they have stock of vaccine. So there shouldn't be an issue of being able to go into a pharmacy and get that vaccine, going into your provider's office. And if you're uninsured or have Medicaid, please call the health department and we will be happy to vaccinate the family.
In most providers' offices
Yeah.
have, it's a common vaccine that we give out all week long, all day
Yeah.
long. So it's
How
readily.
long does that vaccine last in your lifetime?
After 2 doses, you have a 97% or so chance, greater than 97% chance of being immune. And it's typically a lifelong immunity. 2 things we never say in medicine. We never say never and we never say always. So most likely it's a lifelong immunity.
Are you able to release what school the child went to?
It's my understanding that the child was homeschooled. So there's no risk to any of our independent school districts.
Anything else? All right, great.
All right, thank you
Thank
all.
you all.
I
Appreciate
appreciate
you
it.
coming
If I could put that slide.
Yeah. Thank you.
Mhm.